Well, good afternoon. 6 months ago today, we made the difficult but necessary decision to declare a state of emergency in Ontario. We did so to protect the health and safety of Ontarians in the face of this deadly virus. And we never looked back. Because of that decision, we made tremendous progress to flatten the curve and safely and gradually reopen the economy again. But this crisis is far from over. I've said from the beginning of this pandemic that we must always remain on guard. We have to monitor the data closely and make decisions based on public health advice and the science available. And the people of Ontario see the same data I do every day, and they always know what I know. We've seen 2 days this week of over 300 new cases within a 24-hour period. We're seeing similar increases across the country. I said earlier this week that we're prepared to take every step necessary to protect the health and safety of all Ontarians. And the fact is, the public health trends in 3 regions in Ontario, they are concerning. As a province, we have to help them, all 3 regions, not just to stop the spread to other parts of Ontario, but to keep everyone safe and healthy. So we're taking further action today in consultation with the Chief Medical Officer of Health, local medical officers of health, and municipal leaders. We will be implementing further restrictions on organized public events and social gatherings. Starting tomorrow in Toronto, Peel Region, and Ottawa, outdoor gatherings will be restricted to a maximum of 25 people, and indoor gatherings will be restricted to a maximum of 10 people. This includes social events and gatherings, like private parties in your backyard or barbecues held in your home, backyards, and parks. At this time, it does not include events, gatherings held in staffed business or facilities, such as movie theaters, restaurants, banquet halls, gyms, or convention centers. Existing cross-province rules will continue to apply. At all times, people must continue to maintain physical distancing of at least 2 meters with those outside their social circle. We're also introducing amendments to the Reopening Ontario Act to set a minimum fine of $10,000 for the organizers of illegal social gatherings. This is the highest fine anywhere in the entire country, in addition to the $750 fine for individuals who break the rules and show up to these parties. This is a serious situation, folks. We will throw the book at you if you break the rules, and we can't afford to let a few rule breakers reverse all the hard work and progress the people of Ontario have made over the past 6 months. It's just not fair to the vast majority of people who are following the rules and thinking about others. My friends, we're all in this together. This is a difficult period for everyone, especially for families who are struggling right now. And the last thing I want any family to worry about right now is whether or not they can afford to stay in their home. As Premier, I want to make sure we do everything in our power to ensure people can make rent and stay in their homes. That's why today our government introduced legislation to freeze residential rent increases in 2021. For the vast majority of the 1.7 million renters across the province, this means your rent will not increase. I'm going to repeat that, will not increase between January 1st to December 31st of next year. We're leaving more money in the pockets of families and renters so they can get through these difficult times. The legislation will also extend the ban on commercial evictions beyond September 1st, 2020, as far as October 30th, 2020. This will provide more certainty to small businesses who have been seriously impacted by COVID-19. We won't rest until every person, every business, every community can get back on their feet. Before I take questions, I just want to recognize the 19 brave Ontario firefighters flying out to Oregon tomorrow night. They're going out there to fight wildfires. That's the true Ontario spirit, my friends. Always ready to help, And I got to tell you, our firefighters, these guys are absolute, and gals, are absolute champions. I just want to say, please stay safe out there when you're fighting the forest fires, and thank you. Thank you, and God bless each and every one of you, and God bless the people of Ontario. Now I'll take questions.
We'll go to the first question.
Your first question comes from Lucas Meyer with News Talk 1010. Please go ahead.
Hi, Premier.
Hi,
just for clarification purposes, the fines, just to be clear, do they apply to just the hosts of these gatherings, or, I mean, you mentioned on top of the $750, is it just for the hosts, or is it for like anyone who goes to a gathering like this could face the $10,000?
No, it's the host that's going to be charged $10,000, and individuals that show up to the parties, it's going to be $750. And Lucas, you know, this is frustrating for all Ontarians when you have these people that just recklessly ignore the regulations and guidelines that the chief medical officer has put out there. And you know, I sit back, Lucas, sometimes and wonder, you know, they must be a few fries short of a Happy Meal, these people, because I don't get it. They go out there, they know the rules, and they just blatantly ignore it, and they're hurting families. They're hurting seniors, they're hurting everyone when they do it. And when we were doing the tracking and tracing, and I talked to other chief medical officers across the province, I'm hearing the same story, telling me that these are in social gatherings. It's just reckless, and it's not fair. When you have 99% of the people out there, probably even higher, following the guidelines and the rules, and then you have these people going out there and just snubbing their nose to their neighbors and really all other family members, and they hold these big, huge parties. It's unacceptable.
Follow-up?
And Premier, and this is maybe more so for the Minister of Health as well as Dr. Williams, one of obviously the big responses we've gotten in response to the gatherings is the fact that the current rules around the caps in certain classrooms for certain grades are remaining the same. And of course, the NDP has their motion to mandate even further. I'm curious if the explanation to this, why you wouldn't do more on class sizes when you are doing more on indoor gatherings. I mean, do you just see this as simply an apples and oranges comparison, where you have structured rules in place for schools where you may not have them for those more informal gatherings?
Well, it's total, and I will hand it over to the Minister of Health and both Dr. Williams as well, but we're comparing apples and oranges here. We're comparing a school that have cohorts and have the teachers there supervising and have social distancing and wearing masks and hand sanitizer and having nurses on hand, and comparing it to a wild party in the backyard that people are drinking, hugging, kissing, spit, and every other thing they could possibly think of, not paying attention to the rules, spreading COVID. It's unacceptable, and it's just apples and oranges. But we will hand it over first to the Minister of Health, then Dr. Williams. Thank you.
Well, thank you. I think the Premier has put it very well. We're talking about an entirely different situation between the plan that has been set up in our schools to protect our students and these totally unmonitored social events where none of the public health rules are being followed at all. What we have in our schools is a situation where people are in cohorts, they are wearing masks, they are achieving the physical distancing that's required, following the hand washing routine, and so on. None of this is happening in these unmonitored social gatherings. But I would ask Dr. Williams to please come forward with his medical view of the differences between the two.
Well, thank you, Premier and Minister. And they've answered the questions really well. They've heard it all before, and that's really good. We want everyone to understand that when we're dealing with our schools, we've set up a large structure of how to handle that, where people are asked to do a self-assessment tool themselves or for their children before they even go to school, to undertake rules and practices to not go to school, to stay out, to undergo testing when necessary, and to monitor symptoms and signs. As a minister already noted, we have cohorts in the classrooms. This is not a new group of people assembling every day. This is a group that's come together under the direction and leadership of the teacher in the classroom, and the school has set these out. This is quite different than what the Premier's talking about, where you have a bunch of people, some not even sure who's coming, and you have large groups and gatherings. You don't know if they brought illness with them, where they've been. You have no idea of what the practices are. There's usually very little. There's no masking, no social distancing. And these are the events that we really do not want to have happening because they contribute to the cases in our community and spread around in our community, and that invariably can roll back into infect our schools. And we said before, we need those numbers down to make sure that our systems and processes in the schools are not only working well, but they're backed up by the support of the community and everybody doing their part, as the Premier had noted. So quite different, as you said, it's apples and oranges in the comparison.
Next question.
Your next question comes from Dan Drago with Global News. Please go ahead.
Hi, Dan.
Hi, Premier. Just in terms of enforcement for these new gathering sizes, are you in the province directly directing police and bylaw officers to fine people? Only ask just as enforcement in the last couple of weeks has seemed to differ from region to region.
Yeah, we never direct the police. I never will. That's not our place to direct the police, but when we put regulations, bylaws, laws in place, they follow the rule of the law and they enforce the law. So again, it's very simple. If you don't want to get fined $10,000, and there's no reason anyone should be fined, because if you follow the protocols and the guidelines and don't hold the big parties, we're all good. But this is to send a message for the reckless, careless people that want to hold these parties and put their neighbors and the community in jeopardy. So just follow the rules.
And just to follow up, sir, on those new fine amounts,
Yes.
Will recurring offenders be fined more and more as time goes on?
No, we don't have that in place. They'll be charged again another $10,000, and then they'll be going to the courts, and it'll be up to the courts to decide. And I just hope the courts follow through with the fines. It sends a message to anyone out there who wants to be irresponsible. And really, Dan, the vast majority of the people, I mean overwhelmingly vast majority, follow the protocols, and it really ticks them off when they see a big party on their street and they're up till, God knows how long.
Next question.
Your next question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier.
Go ahead, Randy.
I'm wondering if, aren't we creating a problem in that people will take their parties and move them to outlying areas, like they'll hold their gathering of 50 people at Uncle John's place in a city like Hamilton and bring the Toronto problem to outlying communities?
Yeah, I guess there's always a possibility of that, Randy, but I think the people in Hamilton would be great. They'd be calling them out, and they'd be sending folks over there. Just again, just follow the rules, folks. That's all we're asking. We aren't doing it to hurt anyone or punish anyone. We just want everyone to be safe, and it's our job to keep everyone safe in Ontario, and that's what I'm going to do every single day to protect all the people of Ontario.
Follow up.
Okay, and as a follow-up, did you talk to the police about this? Is this a new power that the police want, or do they have more serious crimes to look after, like shootings and drug dealing, or is this a serious crime?
Well, I think when you spread COVID, that's a very serious crime, and in some incidents it could create death, and not all, obviously, but in some. If a young person goes and hands it over to their parents or their grandparents that are 80 some odd years old and they have respiratory problems, and they're in deep trouble. And for what? For a few hours of partying? It's just not worth it. We've done so well. Everyone has been pitching in, companies, people, communities, everyone's pitched in, and that goes back the reason, and again, I want to emphasize is don't take credit for this, it's the people. We have the lowest cases in North America per 100,000 for any large jurisdiction like ours. And the people deserve the credit, and I get a lot of calls and a lot of people I see out there on my travels saying, hey, you got to squash these big parties happening. And everyone, again, is listening, to the exception of a few bad apples out there, and they, we need to fix their little red wagon when they start doing stuff like this.
Next question. Next question.
Your next question comes from Lorinda Redikoff with CBC News. Please go ahead.
Hi there, Premier. Looking at who's included in those gathering limits, yesterday we heard from Toronto's Medical Officer of Health that her team is investigating 4 different weddings responsible for 22 infections. So why aren't events like that included in these limits?
Well, the weddings, they usually are with a convention area or banquet hall, I should say, and they have really strict protocols in place. They're supervised. People are getting their temperatures taken. They're wearing masks. They're socially distancing, and so it's really night and day. And I think all the banquet halls and the restaurants, they've been doing an incredible job. It's their livelihood. They want to make sure that they stay open, so they're really good. They have strict guidelines when you go in there. So there's kind of a lot different actually compared to a free-for-all party, and everyone's going hog wild, swinging off the trees and every other thing. It's totally different.
And this one follow-up is from a colleague from the National.
Yep.
You have said that the federal quarantine system is broken. Today we have news that a billionaire U.S. business executive and her colleagues were exempted from quarantine so that they could travel to the Toronto area for meetings. The public safety minister has now said that a CBSA border officer made a mistake in letting them in. Is that enough? Does that satisfy you? And what needs to be done to fix the system?
Well, there should be one rule for all the people. It doesn't matter who you are. I don't care if you have 50 cents or you have $10 billion. It doesn't make a difference. The rules are the rules, and they have to follow the rules and regulations. I just love our Border Patrol folks. These guys are incredible, the men and women out there, man, standing up there, protecting our borders and making sure they monitor everyone coming in. It's so important. So they're champions, those guys. So if someone slipped up, made a little mistake, and I'm sure it's not going to happen again, but they're the ones we rely on, the first line of defense, I always call it, making sure that we screen everyone that comes into our country, because it's a privilege to come to any country, not to mention the greatest country in the world, Canada. So just treat our rules with respect, and everyone's going to have a good time after the quarantine and after we open up the borders, but not until then. Just stay at home wherever you're coming from, and we'll open our arms up after we get through this.
Last question.
Your final question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. I'm just wondering, these restrictions in Toronto, Peel, and Ottawa are one thing, but why not get out ahead of other outbreaks that we're seeing? For example, at Western University in London, Ontario, there's more than 20 cases just with that one university. Why not have limits on parties and gatherings across the province to get out in front of things? Why just leave it in those areas with 10 and 25? Why not go from 50 and 100 back to 10 and 25 everywhere right now?
Yeah, Robert, really good question. And what we rely on is when the mayors of the city call us up and say they want to make these changes, as each mayor did in each region, along with the chief medical officers of health. When they call up and say, we need the support, we need to do this, by all means. But I think this is probably better to answered by Dr. Williams. Thank you.
Yeah, so thank you for that question. And our public health measures table is looking at that aspect to see how the data relates to the different areas. How is the increase in cases flowing? What are the cases per 100,000? Different methods to understand the metrics. Then having consultation with the local medical officer of health to assess what their needs are at that time as well. So while we have these three, it doesn't mean these will be the only three. There may be one of the reasons we recommend to the Minister of Health and Premier others as we go through this. This is like similar we did with our staging opening up. We said we would monitor stage 3 as well, looking at different aspects and areas of concern. This is an area of concern that's been raised to our attention. We made some recommendations on this time to deal with the areas of most increase and just difficulty watching to say, is this a measure we should use in other areas? Some are not having a problem with this, some are. I would mostly recommend that people looking at it still use some constraint. And while you may want to have 100, I'm saying most of the weather getting the way it is, you may want to still go down to even those levels, even if it's not required in your area, to limit that, to be on the extra safe side, to protect yourselves, your family members, and of course your community. If it's down low, as the Premier said, everybody's done a great job. Let's just make sure we keep it down there. So we're monitoring the situation and we'll update it as necessary.
Follow-up?
And back to the Premier, thanks, Dr. Williams. Premier, we have, I think, more than 37,000 people who've been tested who are awaiting their results. So it looks like we're getting that backlog that, remember, we saw earlier in the pandemic. And I'm just wondering, why are we falling behind again? Why? I mean, is this a problem that we haven't got enough places enough labs to look at the tests, to monitor them? I mean, is this going to be a growing problem?
No, I'm going to, in a minute, I'm going to pass it over to the Minister of Health. But Robert, I remember every day when I come in here, I go by Women's College Hospital, and what a great hospital, and the people over there are incredible. And it's almost like within 2 days, where on a Friday, there's no lineups, and I'm up here begging people to get tested, and then Monday, it was just like a surge right across the province. I understand people are anxious, they're nervous. You know, we see the numbers increasing, but what I can tell you on the fall plan, we're prepared for it. We've planned for this. Getting more testing equipment out into the field as well is going to help, and we do have the lab capacity, but it was all of a sudden the floodgates opened up, and so we're turning it on now. And I want to thank the folks out there testing, all the chief medical officers out there, along with Ontario Health, and they're doing a great job. They're testing 35,000. We're going to be ramping up to 50,000, but in saying that, we also have the labs that will be keeping up with those numbers. But I'll hand this over to the Minister of Health, if you don't mind, Robert.
Well, we do have a fall plan that takes into account all of these issues that will be coming forward imminently, but it certainly does anticipate an increase in the number of people coming in for testing. And when you do the testing, you also need a timely result, so we're going to be boosting our lab capacity as well, even as we prepare for the other issues we're facing, which is flu season coming forward, the number of people that are being decanted from long-term care homes into our hospitals, as well as catching up with the postponed surgeries and procedures from wave 1. So we have taken all of these factors into consideration, and our fall plan will allow us to ramp up to get to 50,000 tests within the next 2 weeks, and then we will move up from there. But along with that, we're going to be augmenting our lab capacity as well.
Thank you.
That's great. Thank you, everyone.